Hi folks, Dr. Ed Beyer here again. Today, many of you know that I do a lot of lecturing on thyroid and how to get your thyroid function back through functional medicine and functional neurology. One of the questions that I get a lot during my workshops is, hey doc, I've had my thyroid gland removed. What can be done about that? Can you help that at all? Or some people just assume that once it's been removed, there's no help can be given. And that's absolutely false. If you've had your thyroid gland removed, so much can be done to improve your thyroid function. So if you've had it removed and you're suffering from fatigue and weight gain and constipation and depression and hair falling out, all the symptoms of underactive thyroid, I want you to pay attention. First of all, it is impossible to remove the entire gland. I use the analogy of trying to remove gum off the bottom of a sneaker on a hot summer day. It's almost impossible to do that. So there's always some glandular tissue left behind, and if you have an autoimmune condition, it's going to continue to go on, and so we can manage that. So that's number one. Number two, it's really important that you understand that most of thyroid problems occur away from the gland. So if you don't have the gland, you're still having thyroid hormone. You're either taking Synthroid or levothyroxine or Armour or one of the different medications. You're on hormone replacement therapy. Here's what happens when you take your medication. That T4, or if you're taking T3, most of the medications are T4. That T4 is jumping onto a binding globulin in your serum, in your blood, called thyroid binding globulin. You could have a problem there if you're making too many binding globulins and the hormone's not able to get off and go into your cells and do what it's supposed to do. That can be a problem. We see that quite often, and this can occur if you don't have a thyroid gland. And what will cause that typically are women who have estrogen dominance. Now, once you take your medication, the T4 jumps onto the thyroid binding globulin. It delivers it to the liver, kidneys, and gut. There, the inactive T4 gets converted to the active form of the hormone T3. If your liver's not working, if your kidneys aren't working, or if you have gut problems, that could be impeding you from converting your T4 over to T3. That has nothing to do with your thyroid gland, yet it has everything to do with your thyroid function. There's an important enzyme that converts T4 to T3 called 5'-deiodinase. That enzyme needs certain nutrients like selenium and vitamin E and different things, B vitamins, to work. And that enzyme won't work if you have high cortisol levels and high estrogen levels. So that could be a problem if you don't have the gland. The other thing is thyroid resistance, this concept of thyroid resistance, which I go into depth in my workshops. If you have high cortisol, which is a stress hormone from your adrenal glands, if your estrogen levels are high or out of proportion with your progesterone, ladies, if you're inflamed, which everybody is if they have a chronic illness, even if you have high vitamin D, which a lot of people do, they hear vitamin D is good and they end up taking too much. All four of these scenarios could cause thyroid resistance. These four things, when elevated, will block your thyroid hormone from getting into the cells. All of these things occur in people without a thyroid gland. So if you have your gland removed and you're still suffering, yes, there's much that can be done. I'm Dr. Beyer. Have a great day.